This patient is a 22 years old male presenting with abnormal echocardiogram, and for further assessment demonstrating degree of left ventricular hypertrophy by echo. So MRI, a cardiac MRI, beginning with assessment of cine images. The short axis, we can see that there is significant hypertrophy of the basal septum. One important part of the diagnosis of the basal septum in measurements of the myocardium is comparing the basal septum to the basal lateral wall, and we can see here that there is significant hypertrophy of the basal septum, 2.3 centimeters, which is significant increase as compared to the basal lateral wall, which is normal value of less than 10 millimeters. So if it's more than 1.5, it's a diagnosis of hypertrophic cardiomyopathy, and this is significant more. So in this view, we can appreciate similar findings, so significant hypertrophy in the basal septum, and this is asymmetric. When we move on to the three-chamber view, this is a very important view for patients with hypertrophic cardiomyopathy. We can appreciate the very thickened septum, basal and mid septum. In this case, we don't see any jet of LV, outflow tract obstruction. And in this cases, we need to assess for any degree of obstruction in the left ventricular outflow tract. Also, there is no evidence of SAN or systolic anterior motion of the mitral valve leaflet. If we go slow during systole, we can see that the anterior leaflet is not moving towards the septum, so there is no obstruction and there is good flow from the left ventricle into the aorta. So there is no evidence of SAN in this case. Now, very important for patients with hypertrophic cardiomyopathy, we need to see for presence of delayed hyperenhancement, and here we have delayed enhancement, both phase sensitive and standard images. We clearly see this patchy area of delayed hyperenhancement in the anteroseptal wall at the base and mid-ventricular level, both mid-myocardial and part of the subendocardial, and that correlates with scar and collagen deposition. And this is the three-chamber view where we can appreciate those areas of patchy delayed hyperenhancement. Patients will have a worse prognosis with the extent of degree of delayed hyperenhancement. And these are just to further illustrate tagging images, cine, that we can better appreciate the degree of hypertrophy of the basal septum. So this patient with a final diagnosis of asymmetric hypertrophic cardiomyopathy, but with no significant left ventricular outflow tract obstruction.